Thank you so much, Leigh-anne. And there you heard it, Darren Scott passing on, and we wish her family long life. And this morning we want to talk about it. After knowing that she went into a diabetic coma, many South Africans are asking about the concerns around diabetes and flu. And this morning we want to limit those challenges or dangers. With us in studio to talk about this condition, Dr. Darren Green is in the house, a multimedia health specialist. Doctor, let's get straight to it. It is alleged that Darren Scott, she contracted flu. It was untreated for a few days, causing her to go into a diabetic coma. I mean, it's something that I didn't know. If you are diabetic and you have flu, how important is it to get treatment for flu?
I think the mainstay of what's happening here is the warning that when you have an infection, any form of a systemic infection, in other words, something that's hit the blood and that's circulating through the different systems, and you have diabetes, it makes sugar control difficult. So whether you're having high sugars or low sugars, both are dangerous. But in this case specifically, hypoglycemia is also quite crucial. So a shortage of oxygen as well as sugar to the brain can have devastating consequences.
Now, if you think about it, those are warning signs for everyone, not just people with diabetes. But are the symptoms for flu the same in a diabetic person than in any other person? I mean, what should be ringing alarm bells for you?
Generally they are. You know, flu generally starts with a runny nose and a bit of a headache, with body pains, myalgia or muscle aches as we call it. But then you also have sometimes a little bit of a sensitivity over the skin. You sometimes become flushed because of a low-grade fever that's commenced or started. And with diabetics specifically, we must remember that they are immunocompromised. In other words, the immunity might even have a little bit of a delayed response, and it makes them susceptible to opportunistic infections. So they need to be meticulous about what they eat, for example, resting enough to give the immune system a chance to actually respond. And
I guess also the medication that they're taking. If you just join us this morning on our Feel Good Breakfast show, we are talking about diabetes and flu, and the two together, talking about going into a coma, how to treat it. Medications, I mean, what kind of medications for flu should people with diabetics take?
So people basically need to look at the sugar content of the medication.
Right.
And the biggest culprits are the liquid things. So in other words, your cough mixtures, your decongestants, your all-in-one drugs, for example, that contain sugar as well as alcohol. There are cough mixtures out there, even some of the natural ones that contain sugar, but they're those that specify specifically that they're safe in diabetics and they're sugar-free. Remembering also that a lot of the tablet preparations also have preservatives and they contain sugar in their coating as well, so one needs to remember that. But along with all that, you often have with sinus decongestion medication for flu, you have medication that contains pseudoephedrine in it, which is a decongestant. And that in itself can make you feel terrible in terms of palpitations, in terms of anxiety and jitteriness. And that's one of the most powerful drugs to dry up the sinuses.
It seems like something that should be flagged all the time. This morning, if you have questions to Dr. Darren Green, we're talking specifically about flu and diabetes. 0839133728. That's our line when we're live here on our Feel Good Breakfast show on Expresso. We're talking symptoms. I mean, how does one check for blood sugar if you are diabetic and you have flu?
Yes, I think when you have any infection, whether it be flu specifically or even a urinary tract infection, you need to check your sugar more frequently. We advocate about actually 4 hourly sugar checks when you're really ill and you have a fever, etc. Because when you're under attack by any infection, your metabolic needs change. In other words, there's a lot more metabolism taking place. Your body's busy recycling foods, burning up energy to fight against the infection because of the increased demand placed upon it. So that automatically affects the amount of insulin released. That's involving taking food that's stored as fat and converting it into a sugar. You also have to check your regular eating pattern to see whether you're getting enough water, you don't get dehydrated with that, and then obviously monitor what you're taking in terms of the whole low GI schedule.
Dr. Darren Green is going to stay with us this morning. 0839133728 if you have a question about diabetes and flu. So we'll take all of your calls after the break. Thanks, Doctor, for being here this morning.
Great.
Stay with us. There's loads more happening on Expresso. Leigh-anne, what you got?